I'd like to call the Human Service and Community Safety Committee to order. It is important to understand that there is no formal voting or decision about the city program policies or budgets will be happening here. Our role is to explore various topics and with staff and stakeholders and community members, and to make recommendations to the council, to our council colleagues. We want this process to be transparent, inclusive, and easy for you to be part of whenever you choose to be. And you can share your thoughts with us by filling out a comment card about the items on the media agenda, and by reaching us directly with other thoughts, questions, or ideas. We need you to fill out the comment cards in advance that can be read into the record for agenda items. The link to the comment cards can be found on our committee webpage at tempe.gov/HSCS. And you will also find the contact information for committee members and staff there for non-agendized questions as well. So we're going to go ahead and call today, June 2nd, 2023 at 12:01 with 48 seconds for the Human Service and Community Safety Committee to order.
All right. So let's see, we're going to have item number 2 is reviewing the minutes. So I'd like to make a motion to approve the minutes from April 28th, 2023.
So moved.
Done. You're on, buddy.
Okay. The committee welcomes public comments. According to Arizona open meeting law, the committee may only discuss matters listed on the agenda. Matters brought up by the public under the public appearance that is not listed on the agenda cannot be discussed by the committee. A 3-minute limit per person is in effect. And is there anybody who has comments or that need to come up? I am looking, I'm seeing none, and we're closed. Go ahead.
So the next item on the agenda is community session items, and we have one item on the agenda for today. That's an opioid crisis, Tempe Innovation Solutions, and I'll turn it over to you.
Okay, we have Waddell Holmes, Director of Strategic Management Innovation, and Daryl. Yeah, no, you can be part of this. All right, you're not listed here, Daryl. So Chief Duty is going to go ahead and help out with Waddell.
Great. Well, thank you, Councilmember Navarro, Councilmember Garland. Thanks for the opportunity and the invitation to speak with you and our community about our opioids crisis. One correction, Councilmember Navarro, I'm still interim Strategic Management and Innovation Director. So, yes, thank you. Interim. Just wanted a correction. That's okay. I don't like to do that in public, but I want it to be accurate. The opioid crisis, again, thank you again for the invitation, because this presentation really aligns and the work that our community and our staff team, along with the City Council, are doing regarding opioids aligns with your council committee work plan, especially in regards to improve our capacity to respond to this growing epidemic. So really appreciate that. Additionally, it aligns to our performance measures within our Safe and Secure Communities Council priority in regards to addressing opioids. And then we have also our other performance measure in regards to youth alcohol, marijuana, and opioid usage rates. So just want to honor that, the alignment of this work with the priorities and outcomes that we're seeking as a city. Today's presentation, it will not just be me. We'll be playing a little bit of musical chairs here today. And I'll start off with sharing some of the progress and work regarding our wastewater biointel program. And then I'll turn it over to Assistant Chief Daryl Duty regarding Tempe Fire Medical Rescue and related data to opioids and EMS calls and dosages. And then after that, Sergeant Rob Ferraro from Police Department will also be joining for the presentation regarding the combined efforts with Narcan and SAVES and programs that they are also working on. Following that, Geronda Montano, she is a Tempe Coalition Special Coordinator. She'll also be joining us to share that effort. As you know, the Tempe Coalition is a strategic partner in us helping to achieve and address opioids and always have been. So we felt it was important to kind of give more of the comprehensive picture of not just what our city team is doing, but also our stakeholders and partner agencies. And then finally, I'd like to wrap up the presentation and share some of the strategies and efforts that we have around a new effort called Octus, and that is really about Tempe innovations and solutions regarding opioids. And so we like acronyms, so we came up with that. Thank you to Tim Birch from Community Health and Human Services for that one. So with that, I'll move over to a little bit of history about the wastewater biointel program. The opioid calls for service were really the catalyst for this program. Tempe Fire Medical Rescue began tracking probable cause calls for service that were related to opioids. This was based on their professional assessment of the scene, what their clients were telling them on the scene. And so at that point, back in 2017, about almost 2% of EMS calls were related to opioids. And so that begged the question of what can we do about that as an organization? Right along that same time, the City Council put out a call for innovation. And so the city and ASU Bio Design Center with Dr. Rolf Halden, we partnered with some innovation funds of $35,000 to stand up the first city municipal-led biointel program. At the time, we just called it wastewater analytics, and we're learning a lot about it in the early stages, and we still continue to learn about that. And then in 2018, the next year, it really was a time to highlight rolling out the program along with compassion and services and sciences. I don't know if you recall, we had our opioid town hall. We were the first community to try to destigmatize opioids as it affects everyone in our community and is not just based on a socioeconomic demographic category. During 2019, we also started looking at, following that town hall, we launched our dashboard and shared the work of wastewater analytics. And then we started talking about the what if. And I remember being in a meeting with Assistant Chief Duty, and we said, what if we could track community health with other biomarkers or data points that we were calling them at the time? So we came up with basically a wish list. And lo and behold, 3 months later, a pandemic comes to our community and across the nation and the world. And we were able to pivot the work that we'd been doing with opioids into to help address COVID. And that was important because we were very agile. Our scientists at ASU were quite agile. We were able to stand up that dashboard. I remember walking out of City Hall on March 13th, 2020, but by May 5th, we had a dashboard up and running with our COVID data. And that was important in regards to the early absence of data that we were getting from other agencies as everybody was trying to adjust at that time. So that is really where we started. Those were two very pivotal moments in regards to the expansion of this program. The other element in regards to Tempe serving as a national model is we extended these services to the town of Guadalupe and still remain in a partnership in regards to COVID with the town of Guadalupe and Mayor Molina. So really appreciative of looking at this from a holistic regional effort. We knew that COVID did not respect zip codes or city boundaries. So we really appreciate the support of the council for letting us do that as well. The operational and CIP budgets expanded in 2021. Those were also supported by grants from the state, and that came about through our relationship with the CDC. If you go the other way, thank you. And then I just want to highlight on our timeline that we did receive a Smart 50 Cities. It's an international award for this work, as well as then we're identified by NACCHO, the National Association of City and County Health Organizations, to become mentors to 2 counties in New York regarding wastewater biointel work. And then finally, we have contributed over 3,600 samples to the National Wastewater Surveillance System, who the CDC stood that up during the pandemic. They reached out to us to kind of say, what's your playbook? And our playbook was really about community engagement. The science was there, but it was about the community engagement and how to create an infrastructure around this. So we've continued to plan and expand our infrastructure. Go ahead. Sorry, we're off slide here. We'll get there. Okay.
Yeah, this isn't working.
Here. Let me try it. Thank you, Daryl. A little bit of help, Eddie? Thank you. Oh, it's just a little slow. Actually, go to slide 6, please. So with all that history, I just want to show you a very quick illustration of, in 2018, we had 5 collection areas. We cover the whole city, and we continue to do so. But what that meant is we had some very large collection areas based on our wastewater system. And so, and our engineer was our best friend during standing up this program. So now by 2023, we're getting ready to actually capture over 11 collection areas, still maintaining the broad work with the whole city. But what that means is that the footprint of each collection area is smaller, so our interventions, our preventions, our education can be a little bit more focused based on the community area that we're really trying to work with. With that, I'd like to share on the next slide that we have expanded to over 18 biomarkers, and we also include drugs, infectious diseases, as well as supporting research in regards to proteins to identify its relationship to cancer. We have some potential biomarkers that we're looking at, whether it's a human stress hormone or the arboviral panel that we're exploring now. So we have started launching a new dashboard. We call that our 2.0, and on that dashboard we have kind of what is wastewater-based epidemiology, most importantly, how is the city utilizing this data, as well as about each of the biomarkers that we're looking at and their signals in the wastewater. So with that, I'd like to move to a couple key data points that I think of as interest of the council. You specifically requested the presentation in regards to fentanyl, and what we're really looking at is a consistent presence of norfentanyl in the wastewater. And what we mean by that is that we're continuing to detect a signal. And we look at the signal over time. We look at trends. We don't look at 1 day or 1 week at a time. We try to look at the trends because it's not a perfect science, it's an emerging science for us. The other thing is that in 2018 and 2019, the average signal was about 12.1, and you can see with this most recent data, which captures it from November 22, when we were able to re-engage with the analysis for opioids, that we've continued to see that signal. We've had a little bit of drop in the month of March, but the signal is back up in all collection areas. Additionally, in regards to fentanyl, we know that nationally you've read stories about fentanyl being combined with xylazine, which is also known as tranq, and is a horse tranquilizer. And so what we did is through our network and our communities of practice, we reached out to a scientist at Murray State who had been testing for xylazine in the presence of rest stops along the Kentucky highways. And so I'm happy to report at this point we have found no detects. And I want to caution that what that means is our instruments and our signal cannot be detected. It doesn't mean it's not in our wastewater, but it's not at a signal where we're able to capture it. So it's one of those like Schrodinger's cat. Is it there or is it not? And what is the signal telling you? The next set of data I'd like to share is in regards to heroin. We are seeing, since we resumed the analysis of the opioid-related analytes, we're seeing no detects for heroin. Whereas prior to the pandemic, we were seeing a consistent signal across the city. And then finally, one of the other areas I wanted to show you was just we also display our oxycodone and noroxycodone. In some of these panels, you'll see for both the parent metabolite or the parent drug and then the metabolite. So the drug that is disposed of into our sewer system without consumption, and then the metabolized is what we consume and then discharge through the wastewater system as individuals. So again, very similar to going to your doctor, this tells us a little bit of the population health of our community. And with that, I will turn it over to Assistant Chief Daryl Duty.
Thanks, Waddell. Good morning. So one of the questions we wanted to answer during this presentation was, what do the fire medical rescue EMS calls for service look like related to opioids? And so you can see on the slide here, we've been capturing, as Waddell said earlier, what we call provider impression. So on our EMS reports on the computer, there's a box that's required for calls, and every time that they run on a call that they think is related to opioids, whether it's an overdose or some other issue, they'll check that box. And so that's what you're seeing here on the slide is provider impression. The orange bars are the total opioid-related incidents since 2017. So you can see the trend there. And then the blue bar next to it is opioid-related transports. So since we've taken over transports for EMS calls in the city, you can see the percentage there. The percentage is consistently in this time period that you're seeing about 83% of the time when we run on an opioid-related incident, we're transporting somebody to the hospital. In 2023, up to April, we're at about 88%. So we'll see how that plays out for the rest of the year. But for that time period right there, it's 83% of the time. So if I can go to the next slide here. No, it's not working. Sorry. All right. So we'll look at the next slide here is Narcan administrations by Tempe agencies. And you'll notice that our Narcan administrations are going up as a city. So, and I say as a city because you can see the lighter blue bar there. Tempe PD has begun administering Narcan to patients that they suspect overdoses there, and Rob's here to talk about that. But you can see there the total administrations are going up every year. They kind of leveled off in 2020, but I'll let Rob talk about their EMS.
I'm going to talk about slide 16.
Okay.
So you
Yep.
got 15.
So next slide. All right, thank you. So this slide here talks about, and it's a very telling slide. It talks about the average dosage of Narcan given per overdose, and I think this is a telling slide because it tells us how much Narcan does it take for us as paramedics to reverse the symptoms, signs and symptoms of an overdose. So typically, somebody who's overdosing from an opioid, they can go, they get sleepy, they eventually go to sleep, they're not responsive, and then if they go deep enough, then they will stop breathing, and then eventually it leads to a cardiac arrest from the hypoxia. We're seeing over time, you can tell the trend line here, that with the more and more powerful opioids that are coming out, the more and more powerful drugs, it's taking more milligrams of Narcan per person every time to wake them up. So, when you run on somebody who's taken heroin, which is kind of the classic opioid drug, that was much less Narcan required to reverse the signs and symptoms of that overdose versus something like fentanyl. And so you can tell that it's becoming important for us to carry more Narcan on our fire trucks like we are. We're carrying more Narcan than we used to on the fire trucks and the ambulances so that we have the ability to reverse these overdoses.
I have a question. Does that, so I have a Narcan that I got trained for it. I have, but is it like one squirt? This is like 4, almost 5 of these, or I mean,
So
or
typically,
dosages? I mean, what do you?
yeah. So typically, one squirt is a dose, and that's typically 2 milligrams of Narcan.
Okay.
And that is the recommended dose for somebody in your situation to administer to somebody who's suspected of having an overdose. What we can do as paramedics, we have a little bit more freedom. We have the ability to what we call titrate it, because if you slam, 6 or 7 or 8 milligrams inside somebody when they're having an overdose, they could go into withdrawal symptoms, which is not good for the patient. So we'll do things like we'll bring them up to where they're breathing. Obviously, we want them to start breathing right away, but we want their level of consciousness to come up just enough so that they're safe. We don't want them to come all the way out and have those withdrawal symptoms. So it's a little bit more nuanced for us than it is for somebody from the public. But if a member of the public is administering Narcan because they think somebody's dying from an overdose, it's really important to get it inside so that it takes effect and they can start breathing again. So that 2 milligrams is the recommended dose for that. Yeah.
Crazy how that number's gone up and how much you have to
Yeah.
give. It's shocking.
Yep. Yep. All right. Next slide.
Yeah, the cops are the opposite of nuanced. So, good afternoon, council members Navarro and Garland. My name is Rob Ferraro, and I'm a sergeant with the Tempe Police Department, currently managing our police naloxone program. I wanted to first provide a very brief overview of our program, which we call the Tempe First Responder Opioid Recovery Project. This project is grant funded through SAMHSA, which is a Substance Abuse Mental Health Service Administration, through the Federal Department of Health, and is a $2 million award over 4 years. We're currently in our final year of the project, which entails one fully funded officer position, which oversees training, distribution, and coordination with our nonprofit partner, Impact Suicide Prevention Center, based here in Tempe. Also, 2 fully funded crisis peer navigators through Impact. Our goal was to quickly train every uniformed officer in the carrying and application of Narcan, while being able to recognize the signs of an opioid overdose. Then upon that application of Narcan to the victim, calling the impact hotline, providing key pieces of information, which then triggered a response from the crisis peer navigator within 1 hour of the call to the victim. Engaging the victim immediately after survival within that window of insight was a key tenet of the program. The peer would be able to develop a connection built upon lived experience. From there, the overdose victim was eligible for 60 days of navigation with impact, which included a myriad of options such as intensive outpatient programs, residential treatment, inpatient hospitalization, children's services, AA or other support programs, housing, employment support, food stamps and insurance, counseling, behavioral health therapies, medically assisted treatment, pain management, and enrollment into SMI services. Our program has gained national attention, being featured in several news articles, academic, and peer-reviewed journals. Most recently, we were highlighted by SAMHSA as a national best practice model for the development of a successful opioid response program. We presented our program and key findings at their national conference in DC a few months back. So slide 16 has 4 key metrics. I'll start with the saves, as this is the first stop in our program. We began in early February of 2020, effectively doubling the amount of saves which we had anticipated to make and wrote for in the grant. Suffice to say, we didn't start with a crawl, but rather a full sprint. As you can see, moving left to right, our numbers increased, capping out at close to 100 per year. Once the save is made, the peer responds to the hospital for that quick engagement within 1 hour, and that is depicted under the crisis contacts column. That is defined as where a peer contacts the victim as well as any family members or friends associated with the victim. That contact entails a lot of connection building through that lived experience along with a lot of empathy. Additional information is obtained along with an ROI or release of information, which then allows us to cross-share info. It's around the same time where Narcan kits to the community, which is in that light blue, are distributed. This can consist of the nasal type Narcan or the older traditional needle variation. We're very liberal in our handing out of Narcan to the victim, friends, and family members. Data shows that more Narcan in the community decreases death and also does not increase use rates. Then lastly, and really one of the most important pieces, is the navigation. As mentioned earlier, the victim is eligible for up to 60 days of post-vention navigational services. Leveraging existing funding streams in the community, we attempt to act as a concierge to the victim or their family, encouraging recovery. We have been hovering at the 50% mark in terms of accepting navigational services. This far exceeds the national average of around 19%, which is why our program is being highlighted and sought after by other municipalities to be duplicated. The final slide, slide 17, shows the enforcement piece of this crisis. Tempe PD, along with many local and federal partners, have seized an incredible amount of pills and powder over the past 3 years. The rate of increase is staggering, as you can see on this chart. And this is directly related to the price, as you can see on the bottom of the slide, where we have observed a 90% decrease from 2021 to 2023. These enforcement efforts come from patrol officers making basic DUI traffic stops to much more sophisticated investigations by our detectives. Thank you. I think 18. Sorry.
Well, good afternoon, council members Navarro and Garland. I am Geronda Montano, and I am the contracted prevention specialist with the Tempe Coalition. So I really appreciate this opportunity for the coalition to represent what is happening in terms of education and outreach from the collaborative partners who are members of the coalition. And so I will give just a brief of what we have been doing from the education perspective to make sure that our Tempe citizens, youth and adults, are aware and ready to respond if necessary, and also ready to prevent substance misuse. So with that, as we're providing education and outreach, we have 12 community sectors that are represented on the coalition. We have really spent a tremendous amount of time in the schools. And if you see on this slide, you'll notice that we have trained over 600 individuals on naloxone and fentanyl awareness. And so with that, we started with the 3 school districts in Tempe. Tempe Union High School District elected to have 4 key individuals on each school campus who were not only trained and aware, but carrying Narcan or aware of where that Narcan is on their school campuses. We use 7 community strategies to ensure that we're not only reaching individuals, but we have an environmental approach to prevention. And so while we're enhancing information and enhancing skills, we're also helping to change physical design and helping to modify policies. And so Tempe Union High School District gave information to each of their high schools so they could determine how they would proceed if there was an incident on their campuses. And so with that, you have athletics who have access to it, you have the school leaders, all school security, and then 1 additional person on school campus who is trained and ready to respond. That was year 1, and in year 1, like I said, we have 600 individuals on those school campuses who have been trained. We also had the opportunity to train school bus drivers in Kyrene School District and school nurses in Tempe Elementary School District. And so the combination of those individuals who maybe see students before school, during school, and then after school, we have safety and more safety in place in case of an emergency with fentanyl or opioids. Our funding sources to ensure that we're able to sustain these efforts come from a few different areas. We have state opioid response funding. We are a member of the Substance Abuse Coalitions of Arizona, who also provide funding. And then we have substance abuse block grant funding. We are in the final year of the Drug Free Communities grant. And so as a coalition, the Tempe Coalition, the concept has been here since 1987. And so when there is a need to respond to a particular trend, the coalition has constantly done that. And so right now, this is the need, this is the trend. I'll try. Thank you. So what you'll also see on the larger scale when we're reaching individuals is a large community effort for education out in the community. So you may see billboards if you're on the 10 coming through Tempe or the outskirts of Tempe, or you're in the movie theaters. You will see advertisement in the movie theaters and billboards that are warning and just giving people more information on the rise in fentanyl. The Shatter Stigma AZ campaign was an effort to ensure that people understand that we don't want to stigmatize what is happening with fentanyl and opioids, but in fact, we want to make sure that people know that there are resources available and that there is no, that there should be no stigma attached to it to ensure people come for those resources. So as a member of SACLA's, I probably should have started here, but the coalition is staffed by 2 individuals, and that staffing supported by Tempe Community Council. The director is Bernadette Coggins, and Nancy Roble is the coalition coordinator. And so with those 2 individuals, they are the leaders who go into some of these coalition meetings with the larger effort in the state of Arizona. So when you see those billboards, when you are on the 10 freeway or coming through the city of Tempe in different places, you'll see some of the same messaging across the state of Arizona. And the purpose with SACLA's is to make sure that there is a concerted effort with similar messaging across the state. So it doesn't matter if you're coming in from the east, the west, north, or south in Arizona, you will see the similar messaging and some of the same billboards across the state. Our next step is to make sure that there's more education and more Narcan in the hands of adults and more education for youth to understand that one pill can kill, and this is not a time where we should be trying anything. We do know that that our youth our young people at Corona del Sol have created a campaign called No Second Chance. And so with that campaign, all of the Tempe Union High School students did get their eyes on that campaign before school ended. So we do know going into the summer months that our high school students were very aware of what's going on because they all saw it at school on the same day. So that's a tremendous amount of youth who live, work, or play in Tempe who have that information. When we look at the members who are a part of the coalition, these are just some of the members who are currently a part of the coalition. The coalition has had interactions with 75 different organizations, and with those organizations, they all maintain their individual identities and obviously have their understanding and their stake in why it's important to prevent fentanyl and opioid overdoses and prevent the misuse to begin with. So these are some of the partners who have been directly involved in the opioid campaigns. And you'll notice some of those who are present here today, like Tempe Fire Medical Rescue, Tempe Police, and then yourselves to be included. We are excited about what has happened and the fact that we could get 600 individuals trained in this first year. And as we move forward, we will be expanding beyond the schools to local businesses and parents and the community at large to ensure that not only we have the information, but we have the resources for people, like I said, to come forward, as well as to prevent an overdose fatality if necessary.
Before we conclude, just wanted to share on our next slide that our innovation solutions team is really focusing on 4 strategic directions in regards to really decreasing deaths as well as the presence of opioids in our community. And being a data-driven organization, we're going to use not only the data points that you've seen today, but additional ones to help inform our operational decisions as well as strategies. And then also, how can we really make this impact? Our outcome is it's written into the purpose of this team. And so with the support of council and our community members, as well as our community partners, we're going to focus on education, prevention, harm reduction, and enforcement. Again, informed by data along the way, as well as through services and compassion. This will be stood up through the city manager's office and an interdisciplinary team. You can see on the slide the variety of teams that make this all work. And on that note, I do want to think that there are a lot of people here today that helped prepare for this presentation. There's a lot of moving parts to this, including your council aides. Just really want to thank everybody for that. And with that, I will conclude our presentation. Thank you.
Appreciate it. Go ahead, Doreen.
I just thank you, everybody, Rob, everybody for being here, Daryl. I think that this information is incredible. And I just wish there was more ways to get this out to the public, that they're really going to be paying attention to what we're doing. I like the idea of it being, the information being in a movie theater. I think that's wonderful. One of the things I had mentioned a while ago to the, I can't remember if it was city manager, assistant city manager, I can't remember who I was speaking to, about trying to get our bus drivers and our orbit drivers trained. Since they are out in the public all the time, it would be great to have them Narcan trained also. And I had mentioned, I think it's on our agenda for our council retreat in August. I asked that our council members all get trained, and anybody who in that room will be trained also. I think that's really important, because I think we need to walk the talk and show people that we're doing it and we know a little bit more about it. So thank you for what you're doing. One of the things I was going to ask you is, you said the Tempe school districts were trained. Is that also including Kyrene School District?
Yes, Kyrene School District, all school leaders were trained, and their school resource staff, so psychologists, counselors, all of them were trained as well.
Okay, I don't know how you reach out in the other schools. I was trying to think of other people in the schools that are really active. And as a past PTO president, I was thinking of the PTO. There are a large group of parents that attend, at least what I remember, it's been a long time, PTO meetings. And that would be another way, because it's usually those parents that are the ones that are really active in the community on the schools. So just a thought that maybe you might want to reach out to the PTOs at the schools and see if they would be interested in doing that. But thank you again for this presentation. I'm glad that we have this. I hope that people are watching. Thank you.
Thank you.
Yeah, no, thank you. You guys did a great job. Just to watch this thing kind of grow from years ago in the conversation. I know that even mine in DC and being part of it, and then just kind of helping orchestrate a lot of this stuff. But you guys have really taken this to a tremendous level, which is, as Daryl said and Rob said, it's nationally known what we do and how we do it. It's what we want out of Tempe, so others can use it and simulate it in so many areas. When we talked about, I think with the funding sources, we had a 4-year funding source. What are we doing to continue it?
Do you have a specific program
So
that you're talking about?
Rob, I think you said there was a 4-year funding source for the program that you were doing with. Go ahead.
Thank you, Councilmember Navarro. So we're in our final year. We so a couple things. One, we underspent a little bit, so we're applying for a no-cost extension, which should get us through a little bit halfway through the federal fiscal year. Secondly, we've reapplied for that same grant. We've written it in a way because we track all the data that we intake, we track. So race, age, right? We know all of those key metrics. And we've noticed over the past several years a pretty high increase in percentage of homeless individuals that are being administered Narcan. So we focused this new grant on the same model, but really focused on homeless outreach together with peers going out in the community. So we should find out probably in the next few weeks if we receive that grant. So that would be obviously a huge piece of sustainability.
Yeah, totally would be. And what are we doing I know that I love the program. I mean, it's just tremendous, the follow-up. I mean, because that's like the best thing we can do is when we have them at their crisis, to have those resources readily available for them to utilize and get the need they want. What are we doing to track after that? I know there's always that fall off, and then we go again, there was a fall off, but is there any metric to track anybody? Okay, they fell off, but they're getting back on their feet, or they're actually back on their feet. Is there anything like that we can get? Or
so with our program, yes and no, to an extent, right? So we have about 50% of our folks survivors of the overdose who we are tracking are engaged in resources. And it's not the 60 days is not a hard and fast 60 days. We have some folks that we've been following for 120 days or so that are still staying engaged with the programs, still utilizing resources. But at some point, yes, they do fall off our field. But we've also noticed that our repeat. We've had several folks in the beginning who have repeated in terms of overdose, and that has stopped over the past year. We have not had any repeats within our program. So, anecdotally, maybe is there some show of success there? But yeah, so with us and within the PD program, we are doing that extensive tracking after the fact to see where they wind up. Whether
Well, I mean, obviously the data, just to have that information readily available, even if it's tracking in a positive way or a negative way, it's the information itself to be able to communicate with the community. I think this would be a great program just to kind of showcase in various ways. I know we do with the schools and getting that information out, but I would love to do a coffee talk on it, to be honest with you guys, and just kind of really make a big deal about this. And I know we could probably both do that, to be honest with you, and really get that education out there, because there's so many times that we go across with parents, hey, what are you guys doing? What are you guys, it's always, we're not doing anything. No, we are doing a tremendous amount of stuff here, and I think that has to be showcased. So I appreciate that. And I appreciate the team. I know Daryl, what is he, a pathologist with a doctorate degree? I don't know what he's doing in the fire department, but anyways, you got a team here that's really tremendous, and I just enjoy the fact that you guys have so many resources here readily available. The partnership with ASU, going after those federal grants, CDC, and really going after it. So please, continue what you guys are doing, because it's tremendous. I think it's a great news story. I think it's a great clip what Tempe's doing proactively, and I think it's just one of those things that collectively all together with the coalition and everybody, because it does take that grassroots, it does take the parents, it does take the community members to really be part of this too, and to help out. So it's a true partnership all across the board. So appreciate it.
So what can we do, Joel and myself, the council, what can we do to help further the education that you have, the information getting out to the community? What can we do with the police department? What can we do with the fire and medical rescue? There's got to be something else we can do.
Well, I think part of it that you already mentioned was just how do we educate prior to it becoming a crisis for an individual or for a family or for one of our students here in Tempe. So working with you on our social media posts, I know we still have a video up from Councilmember Navarro when we started working with this with the regional task force and his service on the NLC committee. So that the awareness piece is something that we could really rally around. I know that there's been studies, and Utah has seen a great success in saturating their state with leave behind kits. That seems to be a positive strategy, and as Daryl mentioned before, it's not showing increase in usage, but it's showing an increase in saving lives. And so those are some things that we would want support with, as well as sustainability for all of these programs, whether it be wastewater, which the council is very generous in regards to our operating funding, as well as our CIP funding for the infrastructure. But I know a lot of programs that rely on grants, it's the what's next. And you heard about 2 programs already in their final year of grant funding. So support in that way where this is more sustainable. We know that we have staff that spend a lot of time on grant funding and the seeking of those grants, and then having to go to Plan Bs if grants aren't realized or are fruitful in the application process. So the support for sustainability of all these programs, whether it be through communication, funding, courageous leadership, which our council has always shown, especially when we first started looking at opioids and wastewater, those are the kinds of things that would support this effort collectively for the community.
Because I can, just listening to you say that, I can see the importance of bringing on the Tempe Coalition as a city department and not a grant-funded program. I mean, I'm just speaking out loud, just thinking about what you do. This is really a human services issue. And that I think it goes to a place where it being under the Human Services Department and in that area, that seems to make a lot of sense. It's touching the kids and the families that are in this community, and we want to be able to do that outreach and make our residents safe. And this just seems like all of the things that you are doing, it seems to me like grant funding was probably the right way to go when this first got started. I don't know, I wasn't here at the beginning, but it just seems like this has grown. I remember when I first went to a Tempe Coalition meeting, they said that, this was first originally started working with the high schoolers, and then a few years later, you're in the middle school, and now we're approaching elementary school kids. This is an issue that we really have to be really have to be paying attention to, and I think for me, I'm going to see what we can do looking forward about not having it a grant-funded program, but in a part of the city of Tempe. It just seems like it makes sense.
No,
That's my thought.
no, absolutely. And I know that when we bring these things up too, we have other battles, within the city. It just really sucks. But I think I think collectively what we're trying to say is I think there's probably a smart way to get this thing on its own legs. Trying to figure out those solutions. Even in the short term, maybe it is another additional grant funding or however we can get those monies to kind of keep it going again. But I think it gives us more awareness and that's why I think this would be a great presentation with the council side and a work study, because it gives the council an idea of what the programs are doing and how we're trying to achieve it, but it also gives them a knowledge that, hey, down the road, we got to think about this program and how it's going to survive eventually on its own, because it can't survive off grant funding. It's like CARE 7. We can't have that just survive off grant funding alone. It has to be part of the city services, so to speak. So I think that with that said, I think that there's a lot of good momentum here in what we're doing and how we're doing. The xylazine. Is it named something else besides
Trank. Tranquilizer.
Is there another name for it too?
There might be another one. I'm not aware, but is there another one?
Zombie. I don't know. I know in Phoenix it's been going around.
Right.
So is it just something it's just hard to track? Is it just, in terms of the wastewater?
In the wastewater, it is. That, again, emerging science. We kind of relate it to fishing. You've got to have the right lure to get the fish that you're looking for. And right now, the assay is coming back as a non-detect, which, again, doesn't mean it's not present. It just means we're having to use even more sophisticated instruments to see if it's actually there. So again, we see this as emerging science. We invite it into everyone's living rooms, but we also know that there's some unknown limitations with it as well.
I was just thinking about it right now. What's so great about this? Because our residents see these things in those areas. I think this would be great if we can try to do something within those areas of education, even if it's just a coffee talk, small council, between me and Councilmember Garland to just educate, just have this presentation within that area. Because when we see that, they either see the impacts of the homeless within that area, what's going on, what are we doing about it? I think it's a great idea that we're showing that we're taking steps in the right direction, but not only that, we're showing that we're being proactive in the right direction. Even the schools within those areas that we're having a hard time, I think this would be great, utilizing that information and hitting those.
Well, as part of our Octus group, we do plan on education and prevention, specific intentional efforts. So not only on the broad scale of a community-wide and tying into regional approaches as well, but really bringing it into the neighborhoods. We have a lot of data that can show where our EMS calls are. We can show where our wastewater signals are, and other where our saves and Narcan leave behind kits are, or where they're not. So those would be some opportunities where we kind of, local government can make the most impact on someone's lives, and so we need to go closer to where people are. A mentor of mine always said, go to them, not wait for them to come to you.
Right.
So we're going to meet people where they are in this approach.
I love it.
The xylazine that we're not seeing or not being able to detect yet, is there statistics that are showing us once the person gets to the hospital, blood test, anything else that we know that we already know that it's here in the fentanyl? Or
I'd have to refer back to Assistant
curious.
Chief Judy. I'm out now, out of my lane, but I don't know if I think that's one thing, the power of wastewater for types of chemicals or infections is we don't always get the benefit of that longitudinal information, post crisis. And so I would defer to Fire EMS in regards to whether or not the blood tests from medical offices and emergency rooms are giving that data back. So
it might be a privacy issue. I'm just
might
curious
be.
because I've heard that it's here, but if we're not able to detect it yet, I'd still like to be able to if
Right.
we know that information to share it with our residents, to say it is here.
Right.
Anyway, sorry, Daryl.
Yeah. Oh, he's behind me. Sorry, I didn't see him. Oh, thank you.
Thanks for the question. Dan Petty, our data and research analyst, just let me know, he's actually the one that put together all of our information. He just let me know that he goes in and checks the health information exchange, which is sort of the backside, right? After they go to the hospital, we can check the medical record and see, for certain purposes, we can do stuff like that. The hard part is you have to go each individual case, right? And so that makes it tough. But he informed me that he's checked a lot of our overdoses recently, and he's never seen xylazine from any of our cases. So that's all we have to go on for right now.
I appreciate that. Thank you.
Yep.
Thank you very much.
Great job, guys. I think that's it.
Again, thank you for
on
the
this.
invitation.
Yeah, more to come. I think that, in direction going forward, I think it'd be great if we did a work study on this just for the whole council. I think this is good information, and then just utilizing the resources on various things that's coming up.
Thank you so much.
Yep.
Thank you.
So new items for consideration, we don't have any for right now. We do have the proposed tobacco ordinance work study session is June 8th of 2023. And our next meeting date will be Friday, June 23rd at noon. That's all I have.
We are adjourned. Thank you guys for coming out today.